I'm Dr. Kenny Levine. Welcome back to Health Talk. I'm here with Dr. Cory Lessner. Cataracts. Do you deal with cataracts?
I don't personally. I've been doing pure LASIK now since 1992. I think it's 21 years. I guess I'm getting old.
Right.
And so I brought a very skilled, experienced cataract surgeon in from Atlanta, Dr. Andy Schatz. And we opened a premium intraocular lens corporation called Sight Trust Eye Institute, which is just adjacent my office. These cataracts are removed with lasers. We had the first laser system in Broward County that removes cataracts.
Right.
And we have multifocal implants that we implant now. So people are moving from late 70s down to late 50s to have cataract procedures now because of the safety of the procedure and the ability to see both far and near to restore the ability to read.
Before we get too much further along, people want to get in touch with you. Where can they find you?
They can find us in Sunrise in the Sawgrass Corporate Park at 1601 Sawgrass Corporate Parkway. Our phone number is 954-835-0800, and our website, which I would direct people to so that they can really get a lot of information, is Have LASIK, like got milk, HAVELASIK.com, and Sight Trust is SIGHTTRUST, two T's.com.
Let's talk about financing for a minute, because that's important to everybody, at least in my practice. Are these procedures covered by insurance?
They're not, and some people have insurances that say that they cover them or that they have a courtesy, but it's basically the insurance company saying, we'll market to our people if you'll give a courtesy. So there are certain people that can get some courtesy, but I usually will ask a person if they can afford $230 a month. Because we have 0%, 0 down, 24-month, same as cash financing, and it comes out somewhere to between $220 and $240 per month for 24 months.
Got it. In our practice, we do surgical procedures, and we have financing for our patients now up to 7 years, not interest-free.
Right, not interest-free.
But people can come to us and have their ideal dentistry done, and typically we do it in one session. For the work that we do, we're working with their restorative dentists, and we have 3 different companies that we work with for up to 7 years financing.
And they can finance it for longer, but the one thing that is really important for people to understand is you're financing your eye care. You're buying glasses, you're buying contacts and solutions and enzymes, and you've got to take those costs out, because we don't live in a vacuum,
right,
in order to understand what the true cost really is, and it's usually a lot affordable. I think it usually works out that between 5 and 7 years for a person to pay their surgery.
I'm sure you have that worked out, that you can, your staff can show them what the savings are per year.
We're about 92% referral.
Patient referral.
42% patient referral, 50% referred in from other doctors. I work with about 150 doctors up and down the coast that either are optometrists and can't do the procedures that we do, or are ophthalmologists and choose not to do the procedures that we do. And so our catchment area, our market scope is a lot larger. People come to us from the Keys, from all the way up to West Palm, and we have patients that'll fly in from out of state or out of the country even to have procedures who can have their pre and post-op care done elsewhere.
That's great for you, because we have television coverage for this show from the Keys all the way up the coast too, and worldwide on the web. Is there a take-home message that you want to give the viewers?
Yeah, if people only knew, if they only knew how easy LASIK, modern LASIK was, they wouldn't wait to find out more about these procedures. And so one of the things that we've done to allow them to see that is we've instituted a webcam where people don't have to watch the surgery, because that kind of freaks some people out, but they can see their loved ones lay down, have the procedure, sit up, and say, look into the camera and say, oh my God, I can see, and why didn't I do this sooner?
You know, that's what I get with my procedures. We take care of infants who are having difficulty nursing. The mom comes out 10 minutes later and says, he can nurse now. It's terrific. You know, this has been, or should I say, eye-opening for me. It's been a wonderful informational session for me. So my message to the viewers is that they can go on, they can see the procedure, and they can hear actual patients responding to their procedure.
It's
immediately.
amazing the things that, you know, people that can't read sit up and can read immediately. People can see their loved ones across the way, and it's just, and you don't have to be afraid that you're going to lose your eyes. It just doesn't happen.
That's scary. Well, I want to thank you so much. This has been
I want to thank
terrific,
you for having me.
and I look forward to
So
visiting
much.
with you.
Please
thank
do.
you.
Please
Dr.
do.
Kenny Levine with Health Talk. We'll see you again soon. Thank you.